Yes, there is security challenge everywhere, but we have a beautiful market close by here. And I must tell you, things are cheap in Wuse market compared to many other places in Africa. And it's quite close. So you don't have any fear, but that does not mean you should lose your guide. You should also know that security is a challenge everywhere in the world. But please be free, go out, enjoy Abuja, enjoy the scene. It's quite beautiful. Thank you. In this meeting, we, the participants of the Second International Conference on PEN Plus in Africa, we recognize with profound concern the immense burden of non-communicable diseases across Africa, particularly severe and chronic NCDs affecting children and chronic conditions among individuals under 40 in poor and economic development. We acknowledge that despite improvement in life expectancy, child survival, access to health services, medicines, and life conditions, inequities persist, especially in managing severe and chronic NCDs, resulting in preventable suffering and premature death, particularly among children, young adults, and poor populations. We reaffirm that strengthened primary healthcare systems integrated with NCDs, maternal and child health, as well as infectious disease programs are foundational to achieving universal health coverage and delivering equitable, life-saving care for severe and chronic NCDs. We reiterate that Africa's steadfast commitment to achieving the strategic objectives of the PEN Plus framework, which aims to address the burden of severe and chronic NCDs among rural and unreached populations through decentralized, integrated outpatient services in first-level referral health facilities, thus bridging the gap in access to care for severe NCDs. We recall and reaffirm our commitment made through the WHO Regional PEN Plus Strategy 2022, the Global NCDs Compact 2020 to 2030, the Global Diabetes Compact 2020 to 2030, primary declaration of the high-level meeting of the General Assembly on the prevention and control of non-communicable diseases, UNGA political declaration on NCDs, WHO Global Action Plan for the prevention and control of NCDs 2013 to 2020, the Brazzaville Declaration to African Region 2011, disease-specific regional strategies adopted by the Regional Committee, 2015 AU Addis Ababa Communique on Eradication of Rheumatic Heart Disease in Africa, 2010 Framework for the Implementation of Ouagadougou Declaration on Primary Health Care and Health Systems in Africa, and 2010 Sickle Cell Disease Strategy for Africa. We therefore commit to elevate severe and chronic NCDs as an urgent health and development priority. Advanced integrated early detection, diagnosis, treatment, and long-term care at all levels for severe and chronic NCDs, with emphasis on primary and first referral care. Promote people-centered care and multi-sectoral collaboration to reduce premature mortality from severe and chronic NCDs, leaving no one behind. We therefore call on governments to fully implement PEN and PEN Plus interventions to expand equitable access to essential services for severe and chronic NCDs in collaboration with WHO and partners. Uphold and finance the PEN and PEN Plus regional strategies, ensuring access to care for individuals with severe and chronic NCDs, regardless of geography or socioeconomic status. Strengthen national health systems, improve surveillance and data capturing for severe and chronic NCDs, and ensure availability of affordable essential medicine and diagnostics, and institutionalize prevention and care. Demonstrate strong leadership in public health by increasing domestic investment and fostering inclusive partnership with civil society, development partners, and the private sectors. Integrate WOPEN and PEN Plus condition into UHC package to alleviate the burden of NCDs on the most vulnerable populations. We urge WHO to intensify its leadership, advocacy, and convening role with partners, governments, and the private sector to keep severe and chronic NCDs and universal health coverage at the center of political and development agendas. Leverage their strength in normative functions to develop standards, tools, and guidance document to support the implementation of the PEN Plus framework in Africa. Support resource mobilization, promote innovations, and facilitate cross-country learning and coordination. Leverage existing collaboration with UN agencies to address severe and chronic NCDs in children. We call on development partners, donors, and the private sector to significantly increase investment in children and poor populations suffering severe and chronic NCDs. Promote research, innovations, and local production of affordable essential medicines and diagnostics. We respectfully request the WHO Regional Director for Africa to present this call to action to the 75th session of the WHO Regional Committee for Africa at the 2025 high-level meeting on the UN General Assembly in September. Africa government to champion this call to action at the 2025 UN General Assembly high-level meeting to galvanize global commitment and secures greater investment for severe and chronic NCDs. We therefore express our sincere appreciation to the Federal Republic of Nigeria for hosting the conference and to all our partners and donors for their continued support. This was agreed on the 10th of July 2025. Thank you for listening.
Thank you very much, Dr. Ntadom. At this point, we're going to ease off a bit. We're going to listen to a spoken word performance by Bash Amunenim. Bash Amunenim is an architect and a poet. He is the general manager of Abuja Literary Society and the current poet in residence of Portsmouth Football Club, England. Bash is also a creative consultant to the World Intellectual Property Organization, WIPCO. Can we please give a resounding round of applause as he makes his way up here? Thank you, Bash.
Thank you very much. Good afternoon, ladies and gentlemen. I'm not very good at standing on existing protocols. I'm good at being a poet. I bring you greetings from England. I came into the country yesterday and I had to rush from the doctors to be here because I'm not feeling very well, but I have an obligation to support any great cause, particularly this one. And I have two poems. The first one, it's about our collective humanity. Then there's another poem I wrote specifically for this event. Freedom exists in small places. close to home. She once spoke through the broken jaws of Jim Crow's law. She spoke of carnage. She spoke of the Holocaust. She spoke of child labor during the Industrial Revolution. Freedom is like hope held in the eyes of a child in North Korea to someday welcome the world into her stead. Our arms are open wide like flowers groomed at our backyard open patch. Freedom questions in those beads of tears down the cheeks of a mother holding the lifeless body of her son, another victim of hate somewhere in Tripoli. In the firm grips of a beggar's bow in South Sudan under the scorching sun, yet he says yes to his heart, yes to his rights, and yes to life. Freedom speaks in black and white. Red or burnt amber, Messiah or the royalty, Buddha or the crescent, bending by the knee, plucking the chaplets, forehead to ground, saluting the deity in the Vatican, in the Buddha, or in the city public pub. In the cloak of our common humanity, freedom speaks to all of us. In the quiet resolution of the crossed or straight of those with hope held behind bars of the free with little rules, the street urchins, even the wolf on Wall Street, the adolescent girl owning her sexuality, or that individual seeking a public office. The capitalist dream, building legals of indices, disc jockeys and food vendors serenading the ghettos of Nyanya. She speaks through the walls of Gulag. She was reverted at the bottom of a totem pole. Libya, Somalia, Syria. Freedom walked the streets of Zimbabwe. She was peopled by a controlled resolve. She sounds like laughter shared by the paved curbs in Freetown. She's the exchange of beer by migrants in Sao Paulo. Freedom is you, freedom is me, freedom is why we're all here, and freedom speaks. Freedom speaks in black and white. Thank you. Thank you very much. So the poem I wrote for this event, sorry, I haven't been able to memorize it, so I'm going to read it. I hope it makes as much sense as it has made to me. It's titled, "This is How We Will All Win." How do we stand whole in our shared humanity when a child's heartbeat is a distant diagnosis? How do we call ourselves home when the road to healing costs more than bread? But listen, a new rhythm beats in the dust of our villages, a movement born of necessity, clothed in dignity, pamplus, no longer a whisper of hope, but a pulse of promise in the health center door. A mother no longer has to choose between life-saving insulin or feeding her children. A father no longer has a son limping toward amputation because the cure lived hundreds of kilometers away. But this is how we will win. In the claps of hands across corridors where the scent of courage replaces despair, where nurses become healers of the everyday battle, where local knowledge becomes power, where a trained eye sees early what used to be a missed opportunity. And this is how we conjure hope, by bringing care home, by rewriting the old stories of pilgrimage for survival, by carrying the promise of prevention in our palms, palms warm with courage of community, palms steady with the promise of a policy that listens, palms weaving insulin, glucometers, pain relief into the fabric of our daily lives. And this is how we will win. When we dare the unseen, we stand as keepers, as watchers, as healers, shape-shifting from a sister to a mother, from a brother to an advocate, from a nurse to a lifeline, policy to practice, stretching the language of care across villages, across borders, across fear. This is a victory embroidered in communion. The everyday fight made possible by hands that do not beg for distant doors. We stand shoulder to shoulder with the World Health Organization, with partners, with you, with me, a chorus of possibilities, a flick of a needle, a drop of rain, a rush of wind. Together we turn the mirage into medicine and this diagnosis into dawn. This is how we'll all win. Thank you.
Thank you very much, Bash Amunenim. For the closing remarks, may I invite Dr. Alayo Shopekan, Director and National Dex Officer for Sickle Cell and Diabetes, Federal Ministry of Health and Social Welfare. Director and National Dex Officer for Sickle Cell and Diabetes, Federal Ministry of Health and Social Welfare.
Thank you. All sitting together here, deliberating on how to move Plus initiative forward in our continent. I believe all of us, we have also enjoyed the hospital, each and every one of you. Our partner that are here, and my colleagues. I can't start particularly on behalf of the Honorable Coordinating Minister of Health, Professor Ali Pate. We know he was not able to make it here, but he was ably represented by the Minister for State for Health of our country, including the Permanent Secretary of Health. I would also like to thank the WHO country office because it wasn't really easy. It was a kind of marathon event for us preparing for this conference. Permit me to specifically mention, yes, thank you. Permit me to specifically mention Dr. Kellias, who is not in our midst, Dr. Mary, the one, Dr. Johanna, I think, please stand up for recognition. Thank you so much. Thank you. You are a wonderful, in fact, you are a wonderful person. Yeah, Dr. Mia, thank you so much. Thank you. Yes, I think other numerous people that I can't quickly recollect their names now. So I think they've been very, very wonderful. Yeah, and also I would like to especially recognize Jane Buckman. I know before now we've been talking on phone. I think thank you so much for coming to Nigeria to support us. Neil Gupta, I believe he's somewhere. Thank you. Thank you so much. We appreciate you. Yes, and we appreciate what you are doing for our country. And I think the partnership is going to become stronger. Yeah, thank you so much. So I would also like to recognize some people in the room. Of course, my boss is here, Director of Public Health, Federal Ministry of Health, and let me see, and others, too numerous to mention. So let me just keep it at that. The Mandate Secretary for Health, Federal Capital Territory, who is also ably represented here, will recognize you, and we thank you for being part of this event. So I will now say that for all of us, we thank you, and we wish you journey mercies back to your respective destination. And before I close this, please, like Director of Public Health has said, you can enjoy yourself in Abuja. Abuja is safe. You should not be scared. In fact, we have a cultural center close here, nearby, that you can actually visit if you want to look at cultural things and things that you can take home as souvenirs very close by. And you can also visit a big market in Wuse, which is also close to this place. Thank you so much. Thank you.
Thank you so much to the moderator for the closing remark. Thank you to our director. Thank you, Dr. Alayo. And it's been a worthwhile 3 days, isn't it? If you've enjoyed the past 3 days, can you say aye? The ayes have it, right? There's no nay. So can we give ourselves a round of applause? Before we leave, just two announcements. We want you to ensure you put down your receiver. Some persons mistakenly went with theirs yesterday. So there's no other day to come back to ask for it. So please ensure you put down your receiver. So ensure you put down your receiver. And some persons met me and said they've not been able to register for today. Please, IT, kindly display the link for people to register. Lunch will be served by 2:30. So there's another announcement for MOH staff and WHO. Remember, there was an agenda that we skipped. And so that meeting will be for 15 minutes right at this venue. Lunch would be served. I would give us shortly the name of the room that we're going for lunch. But just bear in mind that as you walk out of this building is the first turn to your left. So lunch will be served by 2:30. Thank you so much. Okay, someone is asking for general photograph, group photograph. Are we ready for that? Sir? Yeah. Okay, so they say final group photograph. So please, we want to appeal to us. We just have 15 minutes to conclude the meeting between WHO and the MOH, please. And for us to come together for group photograph is going to take a long time. So please bear with us. Thank you. Thank you so much. At this point, it's my pleasure to declare this conference closed. Thank you.
Did you you do me till I can't hold up? Me don't know why you be feeling awkward. My pump, she got it, I got it.